In the beginning, we looked at expanding lactation services throughout the state as just this huge monster. Like it felt like Big Pharma or like, it felt like something just so huge and like we couldn't possibly do it. But as we started to work together, actually with everything that we know, with our own collective knowledge and power, I think we can make a change. And I feel like we are. We're well on the way to doing that.
The coalition partners are Fourth Trimester Arizona, the Arizona Birth Workers of Color, and Lakeisha Muhammad, who's been a huge driving force there. Kimberly Moore-Salas with Indigenous Lactation Counselor. They do work training Indigenous people in lactation. Rizwana Baviji with Arizona State University. She's with the Maternal and Child Health Translational Research Team.
On the coalition, I am a co-partner for the Arizona Maternal Health Policy Coalition. I like to think of myself more of a researcher or an evaluator piece to the coalition, while they are more of the actual on-ground working with patients. Research can still inform individuals. I think it's more like this data, this research, this need for policy should ultimately be translated to on-ground implementation, and that's where these type of collaborations are most effective.
Kimberly Moore-Salas Yanishe, na kaiden na anishle, sit underneath Bashachin, Bashin Hadoriche Yadene, Chachin Dashanele. I'm the program coordinator for the Indigenous Lactation Counselor Training Program. It is a space where we collectively teach from my grassroots the traditional knowledge of cultural breastfeeding as a practice.
I am a certified professional midwife and also the founder and leader of Arizona Birth Workers of Color. Arizona Birth Workers of Color was created to support people who support families throughout the perinatal period. We do that through social support. We gather together, we get to know each other, and we also provide professional development for birth workers throughout the state. So we help to ensure that birth workers show up whole and well in their service to families, and also they're equipped with the knowledge and the education that they need to do so.
I'm the president and CEO of Fourth Trimester Arizona. We support the mental, physical, and emotional health of new parents from pregnancy through the first 5 years postpartum. We realized early on that the time after a baby's born was a time where, to the medical system, the parent disappears. As a result, we have really high rates of maternal depression and anxiety during that time, and it's a huge time of change, all while they're trying to care for someone who expects 24/7 care.
We can only do so much, but that power is amplified when we get with like-minded people. Everybody is siloed, and I think in a sense that hurts us, that we're not able to tap into that collective power that we could have and really get behind an issue. And for this grant in particular, we are addressing lack of access to lactation support for families throughout the state of Arizona.
Improving access to trained lactation support counselors and to meet those breastfeeding goals and requirements.
The gap that is missing is the cultural practice piece, because as we're breastfeeding our babies, we are then really protecting our traditional practice. We have to reclaim it, and the only way to reclaim it is by seeing it in our communities, with our families, starting with our mother.
If we can help facilitate a healthy beginning, especially around lactation and infant feeding, we're really setting parents up for success throughout the rest of that child's life.
Breastfeeding is not an innate way of knowing how to do it when the baby comes out. It's really a skill, and if we don't see it in our communities, our mothers not doing it, it's really hard to continue that practice.
We really work to raise the collective consciousness of the fact that families need support in that time, to really bring that support and that connection to those families, both at the individual level with parents through our villages, and then at the larger, higher levels through our ecosystem work, our policy coalition, and the work we do to reduce maternal morbidity and mortality. We started taking the work that we were doing and using it to write policy briefs, just all with the goal of we need to have all the pieces in place. We need to have like some pieces that are very technical, and here's what we can give to the legislators and others, as well as the actions behind it, the advocacy and the work. I feel like we've been laying this foundation for a really long time with all those different things that we're doing. And when we heard about the systems change process, we were like, I think maybe we are trying to change a system. And is there a way for us to do that?
For someone like myself to have the opportunity to affect an entire system and be able to not just give that gift of a beautiful beginning to just one family, but potentially all birthing families throughout our state is huge. It's phenomenal. It is so electrifying and exciting. The quote that comes to mind to me is, "Many hands make light work."